In our clinic, we offer a treatment that we call the Ocular Surface Cleaning Package. It is designed for two groups of patients. Patients who suffer from dry eye will benefit from the improved eye health that is achieved from having this treatment. Patients who are undergoing any of our open eye surgery will also get two benefits. It reduces dry eye in the recovery period, which is a typical side effect of any eye surgery. It also prepares the surface of the eye by providing a deep cleaning, reducing any surface bacteria that live on the eyelids and eyelashes. This reduces the chance of any issues, such as infection, that could occur in the healing period. The Ocular Surface Cleaning Package is a two-step process. The first step of the process is called BlephX. BlephX stands for microblepharoexfoliation. This is a painless procedure that safely and effectively removes the debris, excess bacteria, and biofilm off the eyelids. As you know, normal bacteria lives in our stomach and on the surface of our skin. We all also have this bacteria and biofilm, which is layers and layers of bacteria that harbor along the edges of the eyelids and eyelashes. This is a condition called blepharitis. This bacterial biofilm clogs the opening of our oil glands and prevents the oil from getting onto the eye appropriately. It is also responsible for the majority of eyelid redness, itching, and irritation. The reason that you get a dental cleaning every 6 months is to remove the bacterial biofilm on your teeth. This is very similar to the biofilm that is present on your eyelids, and it needs to be cleaned in the same way. Even if you clean your eyelids at home, just like brushing our teeth, deep debris can't be removed effectively, and this procedure helps with this. Also, especially if you're preparing for surgery, we need to clean the bacterial biofilm off the surface of the eyelids. It is important to minimize the bacterial debris on the eyelids as much as possible when preparing for surgery, because we desire to reduce the risk of infection as much as we can. While very rare after eye surgery, the majority of infections after eye surgery are caused from the bacteria on your eyelids. By cleaning them deeply, it reduces the risk of this even further. As far as the treatment itself, it is painless and safe. It takes about 10 to 15 minutes to perform. Staff will put a numbing drop in the eye. During the procedure, you'll likely feel a tickling sensation across the eyelids. Each eyelid, the upper and lower, are cleaned individually. The benefits of this procedure are two. It decreases the bacterial load, the bacterial biofilm on the eye, which decreases the chance of an infection. It also removes the bacterial biofilm that is clogging the eyelids to protect your natural oil glands over time. We want to ensure that your oil glands are healthy and functioning for the course of your lifetime. You only get one set of oil glands, and we want to keep them healthy. After cleaning the edges of your eyelids with BlephX, we then want to express the meibomian glands, the glands that line the eyelids, with heating and lid massage. This is the second step of this process. Almost 90% of patients with dry eye have meibomian gland dysfunction, which affects the oil layer of our tears. The most common reason that people have dry eye is not because there isn't enough tears, but it's actually because the tears are evaporating too quickly. The oil layer of the tear is responsible for keeping the tears from evaporating. The oil comes from these glands, which line the upper and lower eyelids. In patients with meibomian gland dysfunction, the oil glands that bring the tears onto the front surface of the eye become blocked and inflamed. When the oil glands harden and block, the oil does not coat the front surface of the tears as it should, and the tears quickly evaporate off the surface after each blink. This causes dry eye. Symptoms of dry eye can include an uncomfortable feeling, grittiness, red eye, burning, stinging, watering, tired eyes, and vision that fluctuates, meaning you'll see differently from one moment to the next. It is also important to note if the oil glands remain inflamed, hardened, and blocked for too long, they can actually die off and atrophy and will never function again. This is important because you only get one set. The oil glands need to be heated to soften and liquefy them, and then massaged to express the oil. You may already do warm compresses and lid massage at home as part of your eye hygiene routine. These are good treatments and are helpful for continued maintenance, but the heat does not get as hot as needed for optimal effect. The oil glands are behind something called the tarsal plate, which makes it difficult to get the heat from the front of the eye. LipiFlow is a 12 to 15 minute in-office procedure. Eye drops are applied and a gentle cup is placed on the inside of the eyelids. Heat is then applied to the inner side of the eyelid, and then a specific gentle pressure is applied, which offers precise removal of the clogged oil from the glands. This technology offers something far superior to what can be done at home. It is important to remove the stagnant oil to prevent scarring and atrophy of the oil glands over time. As I mentioned before, these oil glands can die off over time, and once they are gone, it is believed that they can never be recovered. This in-office procedure is comfortable, and many patients even report it's relaxing, kind of like a spa for your eyes. I've had it done twice myself. The eyes may be a little red and slightly irritated after the two-step procedure, and vision may be a little bit blurry. However, you can resume all normal activities immediately after, including driving. Studies have shown that a single treatment has clinically proven benefits. Many studies have shown that the LipiFlow procedure can even have benefits that last for years, and the BlephX procedure can last for months. Repeat treatments of either can be done in the future if needed. One important detail is the treatment goal is to maintain the structural integrity of the glands and to try to help them from getting clogged, scarred, and lost over time, also promoting better function. However, you may or may not feel any symptom relief. The primary goal is that the body's oil glands are operating at their maximum capacity to give you the healthiest tear layer. This helps keep patients from developing worse dry eye in the future and promotes the best safety and comfort if you're healing from eye surgery. While symptom relief is not our primary goal, some patients will experience symptomatic relief from their dry eye within about 2 to 4 weeks. In summary, the ocular surface package is a 2-step process which helps the eyes produce healthier tears naturally. It is great for patients who suffer from dry eye and also great to help patients prepare their eyes for an open eye surgery.